Welcome to PAG School Learning Center. Today, we hope to conduct Lesson 3 of our lesson series. Today, the lesson is Infectious Diseases and Social Diseases. Introduction. This module focuses on infectious diseases and social diseases. What is a social disease? What is an infectious disease? Symptoms. Under social diseases, we hope to discuss about dise, gonorrhea, and syphilis. Under infectious diseases, we hope to discuss about tuberculosis, chickenpox, dise, rubella, cholera pandemic, and polio. Themes of the module are as follows. To understand the preventive principles of pediatric infectious diseases with respect to disease control, prevention of nosocomial infections, and immunization programs. To understand the pathophysiology, natural history, diagnosis, and clinical management of the common or important clinical infectious disease syndromes. Increased access to quality services to prevent sexually transmitted diseases. Let's talk about infectious diseases. Infectious diseases are disorders caused by organisms, such as bacteria, viruses, fungi, or parasites. Many organisms live in and on our bodies. They're normally harmless or even helpful, but under certain conditions, some organisms may cause disease. Some infectious diseases can be passed from person to person. Some are transmitted by bites from insects or animals. And others are acquired by ingesting contaminated food or water or being exposed to organisms in the environment. Now let's get a knowledge about some infectious diseases. Tuberculosis, or TB, is an infectious bacterial disease caused by Mycobacterium tuberculosis, which most commonly affects the lungs. It is transmitted from person to person via droplets from the throat and lungs of people with the active respiratory disease. Symptoms: diarrhea, nausea, and vomiting. Now let's get a knowledge about another infectious disease called chickenpox. Chickenpox is an infection caused by the Varicella zoster virus. Most cases are in children under age 15, but older children and adults can get it. It spreads very easily from one person to another. The classic symptom of chickenpox is an uncomfortable, itchy rash. The rash turns into fluid-filled blisters and eventually into scabs. It usually shows up on the face, chest, and back and then spreads to the rest of the body. Symptoms: rash that spreads from the torso to the neck. Another infectious disease is dise. Dise is a mosquito-borne viral disease that has rapidly spread in all regions in recent years. Dise virus is transmitted by female mosquitoes, mainly of the species Aedes aegypti, and to a lesser extent, albectic cues. The disease is widespread throughout the tropics, with local variations in risk influenced by rainfall, temperature, and unplanned rapid urbanization. Symptoms: severe headache, pain behind the eyes, muscle and joint pain, nausea, or vomiting. Another infectious disease is rubella. Rubella, also called German measles or 3A measles, is a contagious viral infection best known by its distinctive red rash. Rubella is not the same as measles, rubeola, though the two illnesses do share some characteristics, including the red rash. However, rubella is caused by a different virus than measles, and is neither as infectious nor mutually as severe as measles. Symptoms: mild fever under 100 degrees Fahrenheit, runny or stuffy nose, headache, muscle pain, inflamed or red eyes may develop into conjunctivitis, swollen lymph nodes. Another infectious disease is cholera pandemic. Cholera is an acute diarrheal infection caused by ingestion of food or water contaminated with the bacterium Vibrio cholera. Every year, there are an estimated 3 to 5 million cholera cases and from 1 lakh to 120,000 of deaths due to cholera. The short incubation period of 2 hours to 5 days. Symptoms: watery diarrhea, vomiting, leg cramps. Another infectious disease is polio. Polio is a contagious viral disease that, in its most severe form, causes paralysis, difficulty breathing, and sometimes death. Symptoms: fever, sore throat, headache, vomiting, fatigue, back pain or stiffness, neck pain or stiffness in the arms or legs. Now let's move on to social diseases. Social disease is a polite euphemism for a sexually transmitted disease. Let's get to know about some social diseases. AIDS. AIDS stands for Acquired Immune Deficiency Syndrome, shortened AIDS. It is caused by HIV. Some people may refer to AIDS as advanced HIV infection. HIV is a virus that gradually attacks immune system cells. As HIV progressively damages these cells, the body becomes more vulnerable to infections, which it will have difficulty in fighting off. It is at the point of very advanced HIV infection that a person is said to have AIDS. If left untreated, it can take around 10 years before HIV has damaged the immune system enough for AIDS to develop. Symptoms: fever, raised temperature, sore throat, body rash. Another social disease is gonorrhea. Gonorrhea is caused by Neisseria gonorrhoeae, the bacterium that can grow and multiply easily in mucous membranes of the body. Gonorrhea bacteria can grow in warm, moist areas of the reproductive tract, including the cervix opening to the womb, uterus, womb, and fallopian tubes. They find valves in women, and in the urethra, the tube that carries urine from the bladder to outside the body in women and men. The bacteria can also grow in the mouth, throat. Symptom is painful. Last social disease is syphilis. The bacteria that cause syphilis are called Treponema pallidus. They can enter your body if you have close contact with an infected source, normally during vaginal, anal, or oral sex, or by sharing sex toys with someone who is infected. Symptoms don't always occur in the same order. You may be infected with syphilis and know any notice of any symptoms 4 years